Step 1. Check for consciousness. Before moving the person, make sure that he or she has no spinal injury. If he or she has spinal injury, gently roll his or her head, neck, and shoulders together as a unit until he or she is on his or her back. Then grabs the victim by the shoulders and shout, "Are you okay?" If the victim does not respond, call for help.
Open the person's airway by placing one hand on the forehead and the other hand on the bony part of their chin. Gently tilt the head backward, slightly lift the chin.
Step 3. Look, listen and feel for signs of normal breathing.
Step 4. Locate the pulse. If not, proceed CPR. Step 5. CPR. Step 6. Rescue breathing. Repeat the CPR until rescue comes.
So if you find yourself in an emergency situation, follow this safe step. In a case of a burn, cool the affected area with cool running water as soon as possible for a minimum of 10 minutes. This will reduce the pain, swelling, and risk of scarring. Do not use ice or ice water. Next, cover the wound in cling film or a clean towel to reduce pain. Do not burst any blisters. The burn is severe, immediately call the emergency services. If you find yourself in the right place at the right time, be prepared to save a life and follow these safe steps.
Bumps and bruises are types of damage that occur in the soft tissue under the skin. There is no need to call for assistance when a person suffers a cut, scrape, bump, or bruise if the injury is small, less than 1/2 inch around. There is no bleeding, or slight bleeding. The victim does not feel the numbness or tingling. The person is not suffering from paralysis. First aid for cuts and scrapes. If the injured area has a skin scrape, wash it with mild soap and lukewarm water. Apply antibacterial cream or spray to prevent infection. Cover the wound with a sterile gauge pad and tape or a simple band-aid. Immediately apply an ice pack on the bruise to reduce swelling. Elevate the bruised area so that it is higher than the heart to prevent blood pooling in the affected area. Seek prompt medical help if there is any swelling around the bruise. This can signal danger to nerves, muscles, and bones.
Animal bites. When bitten by an animal, most people want to know if they need a rabies shot. The main wild animal carriers of rabies are bats, mice, foxes, etc. Pet dogs and cats that that have been vaccinated rarely have rabies. However, stray animals are often not vaccinated. Rabies is quite rare, but is fatal if not treated. The treatment is no more painful than a typical injection. Bites that break the skin often cause bacterial infections. Cat and human bites are particularly prone to infection. Tetanus can occur if shots are not up to date. Prevention. First, vaccinate all pets against rabies. Second, do not keep wild animals as pets. Third, do not disturb animals while they are eating, even if they are your family pets. Fourth, do not play with stray dogs and cats. Fifth, do not touch wild animals or provoke them to attack. Sixth, do not handle sick or injured animals. Home treatment. First, scrub the bite immediately with soap and water. Treat it as a puncture wound. Second, if you are bitten by a pet dog or cat, find out whether it has been vaccinated for rabies. Third, a healthy pet that has been bitten someone should be confined and observed for 10 days to see if it develops symptoms of rabies. Contact the local health department for a proper animal observation. Fourth, if you are bitten by a wild animal, contact the health department to determine whether a treatment is needed.